everyone. This is Community Voices TV, bringing you the Minority Report. Of course, we are discussing the coronavirus pandemic. I'm your host, Dr. Aubrey Orrin Lewis, and today is May 5th, 2020. Happy Cinco de Mayo, everyone. Well, this is quite an unusual one in that we're still pretty much in lockdown, even though many people are finding themselves out of their homes. The weather is getting warmer, and so people are leaving their homes, and in spite of the risk, and I would think that there's a substantial risk, people are leaving their homes. So let me say, first of all, thank you to those at home, the so-called essential and non-essential workers, those in the hospitals caring for our sick, and the workers, all of the workers. We must make workers' solidarity more meaningful in the future. We must stand up for our workers. This is a time of change. We must change the paradigm. We cannot go into this crisis, this pandemic, and come out of it unchanged. We must look for solidarity because this is what's helping us now. Solidarity. And believe you me, if we had shown solidarity around the world could have gotten together and stopped this pandemic probably before it started or shortly after it started. But instead, we have petty differences and petty men and women. We allow them to control our lives. The end result is pandemic that's going to come again in another few years if this one ever leaves. And then we will also have global warming and all these kinds of things to contend with. And in a world with no solidarity, we will find that we will suffer immensely as nations. And it probably will be the end of the world. As Noam Chomsky said, we will get past this, but we will never get past global warming. That is interesting. So rugged individualism, that was a myth. John Wayne stuff. That's out. Solidarity must be in. And it's never going to be solidarity from the top. The 0.1% doesn't want solidarity. It has to be the 99%. We have to get together in solidarity. That's the answer. That's the new paradigm. Solidarity. Okay, no more of this Democrat, Republican stuff. Doesn't work. Hasn't worked in 400 years. It's not going to work now. All right, let's take a look at some of the statistics. In a report today from Newsday, the county executive, Ms. Curran, famous for her disappearing act, said that 11% of those tested in the past day or so were positive. I have no idea what that means. But the numbers are higher at clinics in Hempstead, Freeport, Elmont, and Westbury. That's the first time there's been an acknowledgement that there is indeed a disparity in the results. First time. Notice she didn't say who lives in these communities. She just says hire at clinics in Hempstead, Freeport, Elmont, and Westbury. Well, if you know anything about code, clinics tell you right away they're going to be black and Hispanic people. You don't see clinics in Garden City, in Merrick, and those places. All right, so we know where she's talking, but she's speaking in code. She can't even be that honest. She's so racist. Can't even be honest enough to say, you know what? My black brothers and sisters are suffering immensely from this pandemic, and we are going to find out what is happening, and we will do what we can about it. She cannot bring herself to make that statement. Wow, what a racist. I'm not calling her that. Her actions speak louder than words. You don't have to give people a name, they name themselves by their actions. Okay? So 11% of those tested positive, those tested in the past day were positive. We'll talk about that later on. And she's seen a disproportionate impact in our African American and Hispanic community, she said at her briefing Tuesday at OEM headquarters in Bethpage. Now, you would think that as a great a leader as she is, she would be making this statement from Hempstead or Uniondale or Elmont. You would think that she and her Commissioner of Health would be in these areas, if not offering anything but solace, education. I'm with you. No. She's never visited any of these places. She probably doesn't even know where they are. Somebody, probably North Shore, North Hell, North Well, whatever they are, prepared those statistics for her, as they do for the governor, and they gave it to her, and so she's just reading them from the safety of Bethpage, where there's probably one or two or three cases. Okay? So Ms. Curran also reported there are 26 new deaths in Nassau for a total of 1,818. A total of 37,000 in the county have tested positive for the coronavirus since the beginning of the outbreak in March. Well, they didn't start testing in March, so they have no idea what they're talking about. Also, the nanny state said, represented by our governor, that 1,050 Long Island nursing home residents have died of COVID, a total far higher than previously reported. And when we get the data, it's going to be even higher than that. Data reveals disparity also with this antibody testing program that they're coming up with. And it shows a stark racial, ethnic, economic, and geographical disparity. The three surveys of 15,000 state residents since April the 22nd found that Latino New Yorkers were most likely to test positive, with whites the least likely. More than 25% of the Hispanics received a positive result, as did 17.4% of black residents. More than 11% of Asians and 7% of whites tested positive. On Long Island, 11.4% of residents tested positive. In the Bronx, New York, city's poorest borough, 27.6% of residents tested positive, far higher than any borough. Manhattan had the lowest rate of the boroughs at 17%. Of course, what do you expect? expect? Can't have that stuff going on in Manhattan, Park Avenue. Are you kidding me? Overall, 12.3% of state residents tested positive for antibodies as of Friday, down from 14.9% as of Monday, when about half as many New Yorkers had been tested. Statewide, 18,909 people have died from COVID, and you have more than 70,000 plus confirmed cases on Long Island, with the death rate highest in Nassau County, over 1,800. Now, the CDC already have said that these numbers are just very, very low, and they're probably 50 to 75% higher. What is happening with the politicians, as usual, they are only counting the people who have come in contact with the healthcare system, but not the people who are dying on the streets of New York or Nassau County, or who are dying at home. They're not counting those. They weren't even counting the nursing home people until recently. Okay? Now, as far as the antibody test is concerned, it's a waste of time. Chances are, if you have had contact with the virus, you are going to show antibodies that are positive. It doesn't tell you that you're cured. It doesn't say you have an immunity. It doesn't say anything at all. You could still be a carrier of this virus. And I have seen that in my practice, where people who documented cases of infection with COVID, and for weeks and months later, they're still positive for the virus, nasally and pharyngally, and every which way you can think of. So this is I don't know I know who's advising the governor, his buddies at North Hill, and they're giving him incorrect advice as far as this concerned. Anybody and everybody would have some markers. It doesn't say that you are immune. It doesn't say you had the virus to any significant degree. Your body could just be reacting. That's a whole nother topic. Some people overreact, some people underreact, and that's why we have variations in degrees. And that's why antibodies are not the greatest marker for anything. It just says, well, at some point you came in contact with the virus, but it doesn't say where you are right now, where in the curve, the infectious curve you are. Of course, the governor wouldn't know this. His friends at North Hill would have to tell him that, and they don't know either. All right. So this is just another means of making a profit for North Hill. That's it. At the Democratic-leaning Newsday, the governor said at his past briefing that we know that the vulnerable population are paying the highest price. Our seniors, our nursing homes, our poor communities, he said. They are the ones where you have higher infection rates and you have higher risks and exposure. Notice he did not mention the word black citizen. He got a problem. I'm telling you. The man's got a problem addressing the suffering of the black residents. He's so racist that he could not bring himself to say black. Neither is any of the politicians. They got a problem here. And even with this virus floating around, you think they'd have more humanity. They don't. They don't. Code words. You know, high risk, higher exposure, higher infection rates. They live in dense communities. They and they. Who are they? how did they get in these dense communities if you didn't put them there? Okay? All right. He and the newspaper cabal, he meaning the governor, totally overlooked the black population and landed on the suffering of the Hispanics. In every national report, even Newsday, and they're not a newspaper that's particularly friendly to blacks. They're the Democratic arm of the Democratic Party of Northwell. Blacks are faring the worst in this pandemic across the nation. Now, that's not something to be proud of, it's just a fact. Okay? So, where are you, Governor? Stop listening to those racially insensitive folks at North Hill. Here comes the portal. Now, the governor is using the pandemic to introduce the nanny police state. He is saying that starting Saturday, the state wants hospitals to ask patients what type of work they do, whether they use public transit, what health conditions they may have in addition to COVID 19, and if they were admitted from another facility, such as a nursing home, along with the precise location where they live, their race, ethnicity, age, and gender. Wow. Talk about the police state. As if they don't know this. They know when they see you where you live. Come on. They have to ask you this question again, where you live, your sex, your race. They know that. Come on, Governor. Give me a break here. Governor Cuomo, the coronavirus rock star, King Coronavirus himself, never mentioned the effect of this pandemic on his black residents. He's not even surrounded by black employees. He's always there on stage, pretty much by himself, with one or two, people. Some charts as big as New York itself, provided by North Shore, Northwell, North whatever they are. And what's put up there is what they tell him. He doesn't know what's going on. So, Mikey Dowling tells him what to say and what to do. All right. He ignored the suffering of black residents until public advocate Jumani Williams made a point of constantly mentioning it. Then the governor, once it was said, he made a half-hearted statement about disparities. Of course, he didn't mean it. But he did not lay out a plan to address these chronic disparities and the current pandemic in the black community. No plan. It was, they're poor and high risk and they're suffering. But what we can do about it, we don't have money. We can't deal with all of these issues. Then he just abruptly went back to his daily briefing with his health czar, Mickey Dowling, at his side. Of course, the governor has shown by his actions that he does not care about the black and poor communities. He can't convince me otherwise. If he really cared, he would show up and stop that briefing from that nice air-conditioned studio, come into the black community, put on one of these unused masks, these used masks that they sterilize, put on some PPE that was sterilized from 20-odd people, and help the doctors and nurses and give them some solace and comfort. Let them see that we're all in this together. And that would be meaningful. Okay? That's what military leaders do. And since they're fighting a war, they might as well call themselves military and do something worthwhile. Okay? But it's ironic. It was this same governor who closed the community facing hospitals serving these communities. Now he's blaming Mr. Trump, the CDC, the Chinese, blacks, immigrants, and where they live, how they live, what work they do for his failure and incompetence. After closing the hospitals in these vulnerable communities, he gave the carcasses of the hospitals to Northell and his health czar to make a profit. You cannot be more tone deaf than this. Now let's look at the governor's proposal to close Nassau University Medical Center. This is what this talk is all about. Okay? The coronavirus pandemic has shown that the governor, Dowling, and the county executive showed poor vision and leadership in closing the community-facing hospitals serving the black, poor, and uninsured communities. The governor and the Nassau County executive current insensitivity to the black community is of biblical proportions. It is clear by this action that black lives do not matter to the governor and his cabal. The governor, North Hill, and the Nassau County executive, and Michael Dowling, they have decided that it is not in the best interest of Nassau County and the state to keep Nassau University Medical Center open to treat the black community, the uninsured, the poor, immigrant, and the residents of Nassau County. It is alleged that the consensus by Dowling is that the medical center is interfering with the profit making of North Hill. As such, North Hill, the governor, and the Nassau County executive have decreed that the Nassau University Medical Center be closed and the building turned into the North Hill Hilton in honor of North Hill. Hip, hip, hooray. Okay? All right. So, let us look now at a brief history of the Nassau University Medical Center. Nassau University Medical Center was first conceived as Meadowbrook Hospital in 1935. It was a relatively small two-story structure located on the Meadowlands at the junction of Carmon Avenue and Hempstead Turnpike. In the old idyllic days, this was a somewhat wooded area that lent itself to a pasture where lots of sheep grazed. Thus the name Meadows, and the stream that ran through it was called the brook. So we wound up with the conjunction Meadowbrook. Prior to 1960s, care was the province of the rich and those affiliated to religious organizations. The religious organizations came by many names, including Catholics, Episcopals, Lutherans, Presbyterians, and Jewish. In this neoliberal corporate capitalist system, health care for the people was never a priority, and it still is not and never will be. Only profits matter until the system is reconfigured and recalibrated. Residents without religious affiliations had no place to turn for health care. It is at that time and for that reason that the municipal hospital and healthcare system was conceived. The idea was for the local government to provide health care to the unclean and unwashed among us. That the religious organizations, with their various strictures, were failing to provide, sometimes deliberately. after World War II in 1945, with the abundance of capital in hand, the healthcare system expanded at a rapid rate and became a corporate entity. Now it is morphed into being a corporate plantation that treats the workers, doctors, and nurses as the modern day slaves. Isn't that ironic? We now have hospitals getting larger to accommodate the larger workforce. That's after World War II. They started getting larger because we had the GIs coming back. They were getting jobs at Grumman's. They were getting jobs at Fairchild. I mean, Long Island was awash with jobs. Mr. Levitt with his racist housing. Robert Moses. I mean, it was a time where racism was rampant. And everything was growing. Every money was no issue. And so the insurance companies were growing, and everything was happening at the time. We developed a new category of patients, professional patients, the sickness culture. In the old days, if you speak to really old patients, they did not like the word hospital. Hospital was what we call hospice nowadays, a place to go just before you die. So the older folk were like, nah, leave me out of that one. Hospital, no, rather die at home. So that whole concept of the hospital, a place where you go if you're sick, was changed. And now it became a corporate entity caring for the professional patient. See how things have gone? And now we developed a sickness culture, not a wellness culture. People didn't want to be well anymore. They wanted to be sick. And of course, the pharmaceutical industry, the medical equipment, and all of these industries, the lawyers, everybody were just happy to help you with your sick self. Okay? So we get the medical equipment, we have medical schools, needed more doctors. Medical schools became larger. There were not much need for medical schools in those days. In the old days, to be a doctor, you were an apprentice, like a martial artist. You were an apprentice to a doctor. That's what it's called, practice. You stayed with that doctor for many, many years, 14, 15, 16 years. Then you learned all the tricks and whatever books were available. And then you became, after a while, he signed off on you and you became a certified physician. So now they created these so-called medical schools, and it became a rite of passage. Doctors were elevated to the status of gods, and so everybody wanted their son at that time to be a doctor, and nowadays it's son, daughter, and dog, or anybody to be a doctor. But it comes at a cost, significant cost, and rites of passage. And their families willing to spend inordinate amount of money to have the privilege of saying, my son is a doctor. Then we also had the large universities fighting for the government contracts to develop various medicines and research projects for mostly military use. Medicine, that noble calling, was no longer noble, and the profession that cared for patients. It joined the ranks of the greedy, for-profit capitalists. Doctors became businessmen, no different from their corporate colleagues. It became the last frontier if you want to become rich or wealthy in this capitalist economy. Doctors sold their souls and continued to do so for pittance and abandoned the Hippocratic oath for the promise of 30 pieces of silver. Now, for a time, that had the toys of the wealthy. Somebody just mentioned Anthony Fauci to me today, and he's a guy I certainly respected up until recently, where he seems to have been trying to placate the president, Mr. Trump, and now he's saying the various medications are working, even though studies show that they've failed. So he seems to be on the cusp of selling his soul if he hasn't done so already. It seems that people who work in that particular facility wind up losing their soul. I'm sorry for him. Okay, now another change happened. We talked about doctors in their homes and the fancy boats and planes and the homes in the wealthy suburbs, the golf membership, the yacht club. All of that came after 1945, after World War II. Prior to that, doctors were, it was a calling, like a priest, like a teacher, probably a police officer. It was a calling for you to serve. Now it became a club, a rich club, and boy, did they enjoy themselves, and totally disconnected themselves from the mission of compassion and mercy and caring. Another change happened in the 1960s. The Vietnam War was raging, and white men were granted exception from the military draft if they were going to college. Now, I said white men, and, right away people say, oh, well, you're beating up on white men. No, it's a fact. Let's be honest. It's white privilege. The system knew that this exception would only apply to whites because blacks were out and not encouraged to go to college in those days. With the middle class whites in college, the war was fought on the back of blacks and poor whites. What followed was interesting and predictable. Middle class whites became professional students because the war just went on and on and on and on. 10 years, 15 years, 12 years, 13 years, 14 years. So if you were in college trying to get a BA, Bachelor's of Arts, that would not cut it because the draft was still waiting for you. So now you had to become professional. You had to get a master's degree, a PhD, and then, okay, once you they came up with other degrees, business degrees. Let's get an MBA. Let's get what else? I mean, they came up with all sorts. Oh, computer degree. Not really, not enough. How about a law degree? And finally, how about a medical degree? There you really get in and you'll stay forever. Okay? Takes 4 years of medical school, 4 years, 5 years, 6 years, 7 years of an internship residency, then a fellowship. I mean, these things are being tacked on. Then you become a heart surgeon or something, and a dermatologist, some other useless thing, and you go on and make money. Right? So medicine was changed from a calling to a corporate commodity. White men who would have been businessmen now merged the two disciplines with catastrophe we see today. The catastrophe. This was significant cultural shift in healthcare provision that is duplicated nowhere else in the world. The change on the healthcare system was obvious from every perspective. People were, however, too busy making their own money to see this sea change. This capitalist growth was uneven. This capitalist pandemic manifested itself in the religious institutions at first. as well as the wealthy institutions. They served as host for this excess capital. Now, the religious institutions were, accustomed to getting by with just a little bit of money. So when capital became not a problem, they just held their nose and dived in. They were enticed by the large amounts of capital coming from the hedge fund managers, a promise they never had before. They saw their hospitals becoming moderate monuments and marvels, and they were ready to sell their souls for the proverbial 30 pieces of silver. That the various churches and religious groups did. Centuries of caring and compassion, theological and philosophical constructs developed to guide them in caring for their constituents disappeared overnight. Hospitals were now reborn and looked like clones of each other, serving the wealthy, serving the insurance people, and serving the professional patients. And the poor and those who needed service and did not have insurance were left out. So this is a long time coming. Okay? The former religious institutions no longer served their parishioners, religious, spiritual, and mental needs, and all of that, most of the constricts that they had about various religious, we're not going to do this, we're not going to do abortions. Well, that probably is one they kept, but most of the other constricts and prescriptions, religious prescriptions, they got rid of. Okay? Now, the municipal healthcare systems were not included in this corporate takeover. The corporate guys weren't looking for poor people. They were looking for, hospitals that had wealthy people, that had a class of people that they can turn into commodities and make money from. So they weren't looking at poor people. They never do. They're looking at, you have where your zip code is, you have a hospital with a good zip code, and we'll get that one. Okay? So these municipal hospitals were slated to be closed, and they were allowed to deteriorate in service and physical appearance. These systems were looked upon as inferior because they served the poor and became the object of derision. Consequently, as the middle class fled these institutions, talking about the municipal hospitals now, like Nassau University Medical Center, downstate, and Kings County, these are some examples. Jamaica Hospital. They became unsightly places where only the poor would venture, and it had to be the real poor who would venture. Not even the immigrants wanted to go to these places. It's funny to hear them tell you that. Okay? Two things of interest happened in the early 70s. The first was the completion of the new and beautiful Nassau County Medical Center, the dynamic care building on the Sheep Meadow that runs parallel to Hempstead Turnpike. This was completed in 1974, and it was the newest hospital building. And despite being a municipal hospital, it was known as the place to go for the best of care. HIP Medical Group used it as their hospital of choice until moving to Syosset Hospital in 1984 or thereabouts after a dispute with the county, I'm told. The next consequential thing that happened in the 70s was the long march to failure of the capitalist system. It was evident by the fact that for the first time in history, there was an uncoupling of productivity and wages. Wages remained flat while productivity increased. Yeah, because of technology and robotics and everything else. There was an uncoupling. So you need less workers and the productivity increase. Of course, this sent shockwaves through the predator capitalist system. Jobs were being lost along with their earning power. So these corporations became like beach boats at low tide. Those who weren't into getting along with the technology and the robotics now all of a sudden found themselves unable to compete with the more capitalized um, companies. And so they looked terrible. So to get out of this, what they did was they went to the nanny state, which most states serve as far as the capitalist is concerned. And we can see the nanny state operating in broad daylight with the $2.3 trillion handout that the government just came up with for this COVID virus relief fund called CARES. I don't know why they call it CARES, because it doesn't care about anybody. And most of that funding goes to the servers of the nanny state, the big corporations, and the workers, the small businesses, mom and pop stores, have a hard time getting any money. As a matter of fact, the first round ran out of money. And so now they come up with another patch, which will outrun out of money. But with Chris Cat money, Chipotle, the list is long of people who got millions of dollars that they didn't need. Some of them were so shamed they gave it right back. But the poor mom and pop stores are out of luck. This is what the nanny state does. Okay? And it's very interesting that, and it's not uninteresting that this is what happens. Now, something else happened in New York State, and that is the state, along with Northwell and others, came up with some draconian rules to restrict competition to only a few, maybe to one, Northwell. And antitrust regulations were ignored. As a result, in New York, we would we end up with a governor and his trusted accomplice in a scheme and developing a plantation called Northwell. Prior to this, Dowling was an unknown operator managing a relatively unknown 150-bed hospital. With the nanny governor's support, this antitrust consolidation scheme took flight. One by one, community-facing hospitals were forced to contend with the ridiculous and unnecessary and unsustainable state mandates. Most of these institutions were forced into bankruptcy and closed, leaving their patients stranded and available to Northwell. Almost immediately, these institutions were picked up by North Shore, and their portfolio grew from one small hospital to 23 facilities. At the same time, the governor was gaslighting the public by telling them that the hospital business was not profitable, so these smaller institutions must close to make way for an economy of scale, Northwell. Now, if one hospital is not profitable, how is it that 23 hospitals are suddenly profitable. This does not make any sense. Made sense to the governor, but to nobody else. What has happened, though, is Dowling became the health czar of New York, compliments of his buddy, the governor. Whatever the governor says and does during this pandemic is coming from Dowling. The question that must be asked: where is the antitrust investigation by the state and federal government? Where is the antitrust investigation by the New York State Attorney General, Miss Letitia James? How could Miss James allow a system to be installed that visits genocide on her own people? If any of you know Miss James, please ask her these questions. Where is Newsday and Channel 12 to call for an antitrust investigation or do their own investigation into this travesty? Of course, I'm told that Channel 12 and Newsday are extensions of the North Hill Empire, so they're muted. Okay, so let's come back to Nassau County Medical Center. This institution is caught in the scheme between the governor, Dowling, North Hill, and the county executive, Ms. Curran. The governor, Dowling, and the county executive want Nassau County Medical Center gone so that North Hill can have complete control of the healthcare landscape of Nassau County and then subsequently Suffolk. The site is to be turned into a North Hill Hilton hotel honoring North Hill and Dowling. NUMC was designed to be the flagship healthcare institution in a very progressive Nassau County. With the corporatization of healthcare in the 1970s, it was decided behind the scenes that NUMC had to go. The hospital was inflicted with various pandemics, incompetent political appointments for president and CEO, incompetent board of directors, a mile-long list of do-nothing patronage political operatives, and much more. The hospital is all political players installed to see that it fails. Trojan horses were installed to ensure the smooth turnover of the medical center's assets to North Hill. County funding was eliminated. Care for prisoners was not reimbursed. Gasoline that was reported was being stolen. Drugs were reported stolen. Supplies and equipment were reported to be stolen and trafficked. Despite having no money, the 19th floor was transformed into a glass menagerie, a wonderland by Gianelli and the administration. The medical center is unable to pay the state for the employee health insurance. And instead of asking the state to assist the medical center, as they do Northwell, by giving them large grants, the last clueless chairman asked the nanny state to impose terms of payment. How clueless? Some have estimated that in the past 20 years, the medical center has received more than $600 million in aid from the nanny state, federal government, tobacco settlement funds, and other sources. Where did that money go? In a sleight of hand trick, County Executive Galata arranged for the sale of the medical center to the Public Benefit Corporation for $74 million. Yet still, the county still claims they are in hock to the tune of $180 million as a loan guarantee. This can't be true. This can't be true. So there needs to be a forensic audit of the books of both NUMC and Nassau County to put these lies to rest. This is just a short list of some of the pandemics visited on the Nassau University Medical Center. The fact that the building is still standing is a testament to its strength. Now, both political parties played this horrible game with the health of the residents of the minority and other residents of this county. The poster boys for this inhuman act was Tom Swazi and his henchman, Art Gianelli. Together, they really sucked the medical center dry while planning to hand the carcass over to North Hill. Gianelli would say that the reason for handing the medical center over to North Hill is because North Hill gets a higher fee for the service they provide as opposed to the medical center. Of course, none of this was true, and it was used to gaslight the indifferent board and anyone listening to this drivel. He's a gaslight specialist. Apparently, County Executive Mangano saw through it and got rid of Gianelli. The decline continued because Gianelli's influence was devastating to the medical center. Some of the effects: there is no community outreach. This big, beautiful building with lots of wonderful employees. It's sad. No community outreach. The president, CEO, and the board do not live in the community and cannot tell you or show you the community that the hospital serves. There is no research into the chronic diseases such as hypertension, diabetes, heart disease, cancer, etc. This is after the 1998 Newsday series entitled The Health Divide. It showed that blacks suffer the highest sickness and death in all disease categories. Yet still, this medical center sits there, just a beautiful facade, doing nothing for the vulnerable community that it serves. Okay? Newsday is not known to care about black people to any degree. And Newsday is also in favor of closing the medical center because, as they claim, it cannot take care of itself. Where is the investigative journalism by Newsday to uncover the corruption at the medical center and the county, I ask? The support that the county gave to help the uninsured patients was stopped. The cardiology program lost its accreditation, and a brand new cath lab sits unused in a community with a high incidence of heart disease. Because Mr. Dowling and North Shore and the governor says the cath lab will remain closed. We don't have to serve those people. It's obvious. A cath lab, there are two cath labs from two smaller hospitals, Mercy and St. Joe's. About 3 months ago, received permission to open their cath labs. Now, these are two very small institutions that, if you put them together, do not have the bed size or whatever of the medical center. Yet still, they were granted they were granted cath lab privilege. And they both operate out of communities that do not have a particular high risk of coronary artery disease. But again, that's what the governor wants. That's what Dowling wants. That's what the county executive is told that she wants. And as far as the black and brown residents of Nassau County, the governor and Mr. Dowling and Ms. Curran will tell you, let them eat cake. They're not going to get a cath lab. Matter of fact, they're not going to get any services. Just like how we don't pick up the garbage in their community and we dump all of the illegals and obnoxious people in their community, we're going to close this facility and turn it into a hotel. So they're not going to have it. We don't want them to have anything. This is their mindset. Okay. The pediatric department was closed. OBGYN is gone. All of these closures and reductions are being orchestrated by the governor, Mikey Dowling, and the county executive. How can you strip the hospital bare of its assets, the assets it needs to serve the community, then claim that the hospital cannot support itself? It's like removing the fins from a shark or the tusks from an animal and saying, well, wow, he's so docile, can't support himself. Of course it can't. Okay? It's a case of blaming the victim, like the governor did at the press conference. The coronavirus pandemic showed how important Nassau University Medical Center is to the people of Nassau County and the black, minority, poor, indigent, and undocumented members who share our humanity. NUMC was deliberately sidelined during this pandemic. You notice? Nobody mentioned it. The county executive went as far as Bethpage at OEM to make an announcement, totally bypass the medical center, her medical center, this county's flagship institution, 19 stories high. OEM is a little outhouse somewhere in Bethpage. She bypassed this and went all the way to Bethpage to make an announcement today. Interesting. The governor never came to show his compassion. The fact that blacks and browns and whatever are suffering here in Nassau County is of no interest to the governor. As I said before, you would think that he would come and don one of the very, very used masks that he and his healthcare people are asking our healthcare workers to wear, and put on a very, very, very used but sterile, recleaned PPE that he is forcing our healthcare workers to use. He should don those and come and walk around and show his face to the people. That's what great leaders do. They come around and they talk to the soldiers on the front line and show support. You may not even believe the guy, but at least you have to say he came. This lady and her governor and Mikey Dowling They totally ignored the medical center in this crisis. Just to tell you that they have it in mind. They've already made the decision that they want to close it. So they're not giving the medical center any name recognition. No matter what it does, it shall remain nameless because they already want to turn it into that hotel, Hilton, Northwell. Okay? The governor visited Northwell for a photo op with his healthcare czar, Mikey Dolan, by his side, Dowling, but not the medical center. Many in the community have said that NUMC, or Nassau University Medical Center, was allowed, if allowed, to be free of political interference and malfeasance and be a fully functioning research institution that it once was and is still capable of being, the pandemic would not have been so devastating in our community. So, the devastation in our community must be blamed on the governor, Mikey Dowling, and Laura Curran. Let's be straight up honest about it. If they had cared, if they had seen, and they knew that this pandemic was coming, and made sure that every community was protected, then we would not have had, we would have had enough beds, enough respirators, enough ventilators. We would have had everything we needed. Nobody's asking these wonderful people for anything else. The community is asking for an opportunity to care for itself. The medical center should be allowed to be the medical center and care for its community and its charges, and not be used as a political football, not be used as a particular another entity to make another hotel. That's what they want. Healthcare is not a democratic prerogative, at least not the Democrats in this county. It's a profit prerogative. And as long as Northwell can get their way, that's the way it's going to be if we allow it. Okay? So here are some questions, some existential questions I have for you. Do you agree that if Nassau University Medical Center functions freely without political interference, it would have made a difference to our community during this pandemic? Do you agree? Do you agree that we should have NUMC fully functioning for the next pandemic? Do you agree with the governor, Dowling, Northwell, and County Executive Curran to close NUMC? In other words, do you agree we should close NUMC? That's an interesting one. Okay. Do you think that NUMC should be closed by the governor, Dowling, and the county executive Curran, and turned into Northwell Hilton Hotel? Would you participate in efforts to keep NUMC open and fully functioning? Would you support efforts to keep NUMC open and fully functioning? Would you write letters to the governor, Michael Dowling, and county executive Curran, telling them to take their hands off the medical center? Would you write letters to the governor, Mikey Dowling, Laura Curran, to keep the medical center open, fully functioning, and free of political interference? Would you join an organization such as the Friends of NUMC to keep this vital institution open to the public? fully functioning, and free from political interference. Would you let County Executive Curran know that the community will hold her and the rest of the cabal responsible and accountable for any attempt to close or disrupt the full functioning of NUMC? We must stop this incompetent imperial governorship before the next viral pandemic. If not, things will be manhandled in a worse manner, further compromising the health of every resident of New York State. We must let the governor know that we are not commodities, that our health and health care are not for sale for a profit to the cabal and Northwell. We must let the governor, Mikey Dowling, and Curran know that we are aware that they are using this viral pandemic as a portal to enrich themselves and introduce measures to suppress and unleash a predatory pandemic on the people headed by Northwell. We must let the governor, Mikey Dowling, and Curran know that by letting the virus roam wild in the black community, we are aware of their plans to inflict genocide on the black community. The governor never once acknowledged the devastation the pandemic has caused the black community and offer consolation and recommendations. At least President Trump acknowledged this strategy. We must let the governor know, Mikey Dowling as well, and Curran know, that we are watching their lack of response to the suffering of the black community and will hold them accountable and responsible. Members of the black community who are awake, blame the governor, Mikey Dowling and Curran, the Nassau County Executive, for the disastrous effect of the coronavirus on the black community and the abject racism and incompetence by which it is being handled. Now that the state will receive billions of dollars from the federal CARES handout, I'm curious to see how much the governor will award his buddy, Mikey Dowling, for being a good and faithful servant to him and assisting in wrecking the New York healthcare industry and denying black communities health care. We must do better. We can do better. We must stand up for our self-interest as the governor, Mikey Dowling, and the county executive, Curran, stand up for the interest of their neoliberal capital cabal. This is a time to invest in our hospitals and healthcare system. We must invest in education and cooperative ventures that are democratic as opposed to the capitalist system. New York must be reimagined to be more caring and compassionate as opposed to caring to the Bloombergs and the other 0.1% cabal members. We must fashion a state that we want to live in peace, harmony, and be healthy, rather than hospitals that prey upon and make a profit on our illness. We need to develop public health prevention programs with built-in research and surveillance to warn us about forthcoming pandemics and give us time to develop the protective equipment and strategies. We must keep our safety net hospitals open and fully functioning. The U.S. spends a significant portion of their GDP on healthcare, but it's reported that approximately $760 million are wasted, and that is a conservative estimate. In Sweden, Germany, and most of Europe, all citizens are covered in their healthcare. In Germany, healthcare is not allowed to be a profit center. The healthcare industry is only allowed to make approximately 5% above cost. In these countries, healthcare is a national security priority. This is what it should be in every country. History has shown that the strength of a nation is judged by the health and healthcare of the poorest individual. We must protest to the governor, to Mikey Dowling, Nordhell, and the county executive Curran to stop the rape and closure of Nassau University Medical Center. We must insist that the medical center be allowed to return to its fully functioning community-facing status and be free of detrimental political interference and patronage that has literally almost killed this institution. Okay? NUMC must be allowed to serve the people of Nassau County and the vulnerable populations. We must remind the county executive and the governor, as well as the rest of the cabal, that the people will not forget this and will hold them responsible and accountable for the suffering the black community is allowed to experience in this pandemic. We must not allow the cabal to close Nassau University Medical Center. It is our civic duty to resist this imperial governor and his cabal. If not, the next pandemic will be much worse. We must make these politicians respect and fear our vote. They are too comfortable and act as imperial majesties, treating the residents as subjects. The governor and his daily fellow virus briefers will have to go into detox at North Hill for TV withdrawal when this is over. After this pandemic, we have to decide, what kind of world do we want to live in? Do you want to live in a world led by these incompetents? Or do we want to live in a world with democratic principles, peace, and harmony as our guiding light? What kind of a healthcare system do we want? What kind of an education system do we want? What kind of political system do we want, if any? What kind of environment do we want? What kind of relationship do we want to the environment? What kind of relationship do we want with each other and the rest of the world? We must become self-sufficient. And I must say in closing, ladies and gentlemen, we can do better. I know this is a lengthy discussion, but it's also a very important topic. And if you can't listen to it in full at one time, I want you to take it in pieces and listen to it. It has historical resonance, and it has resonance with this pandemic, and it has resonance for the future. So it's up to us. It's up to you. If you want to sit quietly in the sidelines and allow this governor and his cabal to dictate the kind of healthcare and the kind of service and the kind of life and world that you should live in, rather than participate in shaping and fashioning the world that you want to live in, then don't complain. Go along with the program. But if you want something, and I know we can do better, if you want something better, it's called We the People. It's not the governor. We elect the governor to manage our affairs, but not to manage our affairs as he sees fit. It's to manage our affairs as we see fit. Now, let's take an example. If you hire someone to manage your finances, you've come into a few dollars. Do you allow that advisor to manage your finances as he sees fit? Or do you want to participate in the management of your finances? In other words, he is a consultant and he should give you advice, and you should weigh that advice and then decide what you want him to do. We have gotten away from the democracy where the people, we the people, rule. What we have is this fake democracy that we tell the world about, which does not exist. And we have little small fiefdoms and little small imperial personalities running our counties and states and everything else, and even our country. And so, we have lost. We have to retake the high ground and be the country that we want to be. So, with all of that said, until next time, thing